continue to enhance tertiary care hospitals, we have also placed special emphasis on expanding and strengthening primary health care across the province. Our focus has been on managing priority health issues and improving access to care, particularly for non-communicable diseases such as cardiovascular conditions. A cornerstone of our approach remains the Lady Health Worker Program, an initiative introduced by Shaheed Mohtarama Benazir Bhutto in the 1990s. This program continues to be one of Pakistan's most impactful community-based health interventions, delivering essential services directly to people's home and empowering communities. We also recognize the increasing importance of the private sector, especially in the urban areas. To address the growing demand for primary care in cities, the Government of Sindh is actively promoting public-private partnerships. Our early initiatives, such as contracting our primary healthcare services to the People's Primary Health Initiative and outsourcing district hospitals to specialized NGOs, serve as successful models for expanding access and improving service delivery. Since the devolution of the health responsibilities under the 18th Amendment, Sindh has consistently increased its health budget, with a special focus on preventive and primary health care. Just to give an example, in the last 5 years, our health budget has increased from 114 billion to more than 320 billion rupees this year. It's almost tripled. Health right now after education is the second highest, has the second highest budget allocation, and the increase in the last 5 years, even longer, has been much higher than any other sector in the province. However, we acknowledge the challenges that lie ahead. Despite our efforts, certain regions continue to face poor health indicators. This is why initiatives like Pakistan's Primary Healthcare Learning Agenda led by Aga Khan University are so valuable. The sharing of knowledge and best practices amongst provinces will help us collectively move towards universal health coverage. It is also important to remember that health is not just the responsibility of the health sector. True progress requires a whole of the government and whole of the society approach. Whether it's designing safer transport systems or addressing the impact of climate change, we must ensure that health is integrated into all our policies. I am truly encouraged to see such a diverse and committed group of stakeholders gathered here: government officials, academics, health experts, and international partners, all united by shared goal of promoting better health and well-being of our people. For example, the hospital in Badin, which we are running with an NGO, with an NGO is also now catering patients from the neighboring districts. So what we need to do is the whole of the province approach and not only Tadolaya. And inshallah, I assure the health practitioners here, I assure the people who want to make that change that the government of Sindh is committed and will support you all the way. Our resolve to improve the health services of this province are there, and inshallah, as I said, one example is, and I'll just quote this one example in my seat. A few years ago, Childlife Foundation came over and they wanted to prove, the aim was that a child in need of emergency services should not be more than half an hour away from a hospital. We started that in Karachi. We've got about 6 centers now, I think, Childlife in Karachi. Then we went to, we've got 8 or 9 satellites in the province, and we've linked all our district headquarter hospitals by telemedicining to the center here in Karachi. And the infant mortality numbers have become so much better since then. What I understand, and this is what they've claimed, I don't know if this is true or not, I don't know if this is the right place to say it or not, that the infant mortality numbers, I'm not an expert at this, in our child life centers are better than Aga Khan University. hospital. So, uh, so the government's resolve is there. Yes, we need help. We need help from institutions like the Khan Hospital. We never say no to anybody who comes in for any improvement in the health service. Just before this, when we were waiting for the symposium to start, the health minister and the dean talked about a few initiatives that we want to do together for allied health services, for nursing, for other technical services for hospitals, and I assure you that the government of Sindh will inshallah be very forthcoming, and you will actually be surprised at the speed that we want to